All right, good morning, everybody, and thank you for joining us for our second Ask the Expert session on what are the rehab options now with Shannon Sproule, Cynthia Morin, Jasmin Ma, and Kathleen Martin Ginis. So each guest speaker is going to start by introducing themselves and give us a better understanding of what the current situation is, what the future holds, and what we can be doing, all related to therapy that we're missing right now. We will then end with any questions and comments that you might have. And I'd also really want to just mention again, as I did last time, that we're very, very grateful to the funding that we got from the Craig Nielsen Foundation, and thank them very much for giving us this opportunity to be able to provide these sessions with you all. So let's get started, and we're going to start with Shannon. So please take it away.
I am a physio at GF Strong, and I also worked with access therapy in the community, and I work with SCI. So I got my hands, it's all about spinal cord though, that is my thing. So just to speak on what is being offered for spinal cord services right now. Outpatient services are not totally cut off, but we are offering some outpatient services at GF Strong. And I actually have the information on what the community is offering as well. But it is minimal, as you are all people with SCI probably are aware. They are going to be talking this week, so the discussions are in the process to look at doing some kind of slow startup with elective surgery and with some increase of outpatient services. So there's no decision made, but the discussions are in the works. So right now, we have seen a couple of outpatients in the center. It is very high priority, so it's wounds. Predominantly, they've been wound and people that are possibly at risk of having to be hospitalized because of their condition. And so we will see them. They are met at the front door of GF Strong, given a mask, and escorted to an isolated place to be seen by the team. So we are really looking at protecting whatever client comes in for any services. And after they are seen, they are seen by whichever team members are seen to be appropriate, and they are in full protection, and then they are escorted out. So that's what's being offered right now. There also is, of course, telephone and Zoom conferencing and assessment that has been ongoing. And if people do have issues and they haven't been contacted, they can contact GF Strong if they have some questions or concerns, because the outpatient team will do any phone consultation. The community is somewhat similar. They're doing a lot of phone and telehealth. Their big priority for the community is preventing hospitalization or assisting with hospital discharge. That's their big priority. And then their high risk is safety with falls, transfers, those kind of things. They will look at going into the home for that.
So I'm an occupational therapist in the Spinal Outpatient program as well, working on the same team as Shannon. Shannon and I also work on the team at the wound clinic, the SCI wound clinic down at BGH. And the message that I would like to just relay that Shannon also said is we're still open in our outpatient programs. We show up every day at work. We're here to help people. It's just how we're able to help people is very different right now, and presenting some challenges where we're kind of making it up as we go along. The goal is to try and provide services, necessary services to people in BC while minimizing person-to-person contact. So keeping everyone that we help safe, keeping ourselves safe, keeping the inpatient population who's still here, who's still, still having injuries, still needing inpatient rehab, keeping them safe. So there are a lot of measures that have been put in place, but that being said, we're still, I guess you could say, open for business. So on the VCH website, I believe you can find the referral forms for our outpatient program as well as for the wound clinic. So if you are needing any type of social work, physiotherapy, occupational therapy services, physiatry services, please download that form and send it into GF Strong. You are supposed to have a physician referral. That being said, I think there is some understanding that accessing physician services is challenging right now, particularly people who have spinal cord injuries. And so if you feel that you are in real need of our help, then please do send in the referral form, even if you're not able to get a doctor's signature on it, and we'll follow up on that somehow. Another thing I want to let people know is that the ministry is also still processing equipment requests for funding, and same with extended health providers. So we are definitely prioritizing who we are able to see in person here. The high acuity people would be people who have wounds or people who are experiencing a fairly new onset or significant deterioration in their function or health. But also if your equipment is in dire straits to the point where it's risky for you to use your equipment, then that is also something that we would be able to prioritize. And for people who are requiring new equipment but may not necessarily be in dire straits, we still are trying to provide assistance virtually with that. So I'm seeing clients right now who they may not necessarily have changed a lot in their seating needs, but their equipment needs replacement. And so I'm helping them through that process. So I don't have much more to add to that other than we're here. We're happy to help as best as we can. So use us if you need us.
Thank you, Cynthia. All right, Jasmin.
I don't know, actually, if Kathleen, you wanted to go first, and then I'll kind of follow up with some exercise recommendations. So maybe Kathleen, you'll take it away with the guidelines.
Why don't you get started introducing yourself?
I'm Kathleen Martin Ginis. I'm a professor at UBC on the Okanagan campus, and I work in the Department of Medicine and also in the School of Health and Exercise Sciences. And most of the work that I do focuses on how to increase physical activity in people living with spinal cord injury. And I also look closely at both the health and the psychological and the overall well-being benefits of physical activity for people with spinal cord injury. And over the past few years, in partnership with Spinal Cord Injury British Columbia and with partners throughout the world, we have together developed a set of exercise and physical activity guidelines for people living with spinal cord injury. So I'm going to share my screen and show you those guidelines. All right, so the physical activity guidelines for adults with spinal cord injury are essentially developed in mind for people who are not doing any physical activity or very little physical activity right now. And the guidelines have two levels. The first level is a starting level, and the guidelines recommend that people increase their aerobic activity to 20 minutes of aerobic activity 2 times per week. And that's aerobic activity at a moderate to vigorous intensity, and also to do strength training twice per week. So 3 sets, 10 repetitions of strength training activity twice per week for each major muscle group. Once you have worked up to that level, the guidelines have an advanced level whereby it's recommended that the aerobic activity be increased to 30 minutes of aerobic activity 3 times per week. And we know, importantly, these guidelines were developed based on the highest quality scientific evidence that is currently available regarding the benefits of exercise for people living with spinal cord injury. We know that if people are exercising at the starting level, that they will experience significant improvements in both their cardiovascular fitness and in their muscular strength. And we also know, based on the scientific evidence, that if people are working at the advanced level, that they will reduce their risk for things like heart disease, diabetes, and obesity. We have also developed, in partnership with SCIBC, a website that you can go to, not just to find the guidelines alone, but you will find lots of other information on how to implement the guidelines into your routine. So we have lots of examples of activities, tips on becoming more active. If you want to know more information on how the guidelines were developed, that's there. And I'll have some more information on resources to support you in starting and maintaining a physical activity program, but I'm going to save those and hand things off to Jasmin, who's going to give you a few tips and tricks about implementing the guidelines at home. So I'll hand it off to you now, Jasmin.
Great. Thanks so much, Kathleen. It's so lovely to see so many familiar faces, but also see some new names and faces on the screen. So what I'll share with you today are just some tips and tricks about how to exercise at home during these very different times. And these are some tips that you can use not only now, but in the future when we have a little bit more freedom in what we're able to do. So where I kind of like to start is to ask yourself these three questions. So the first one is, what or how much do I want to do for physical activity? And importantly, why? Why do I want to be active? Number two, what might make this hard to reach that goal, or what might get in the way? And number three is, what sort of equipment, resources, or strategies do I have to meet those goals? And so Kathleen really nicely outlined our spinal cord injury physical activity guidelines. And an important point that I like to make here is that, especially for folks where you might not have started any sort of physical activity, these are the guidelines that we can start to work towards, but doesn't necessarily mean you need to start there on day one. So really importantly, if you're not ready to meet those 20 minutes twice a week just yet, that's okay. That doesn't mean that that's a point of discouragement. It's something that you can look forward to in the future, but set those goals and those priorities there for you for what you can achieve right now and work your way up. Another thing to think about is, when deciding how much you want to do and what you want to do, is why do you want to do it? So a lot of our clients have noted things like wanting to be able to better play with their kids, or be more independent with their transfers, or just because you like physical activity. So if you have that goal in mind and why you want to achieve that goal, it can be helpful for you to decide what you want to do, but also perhaps to help you stick to what you want to do. So our second point here around the barriers, or what might make this hard or get in the way of that goal. These are probably some of the most common barriers we see with our clients. So number one, especially right now, whereas Shannon and Cynthia mentioned that access to care and healthcare provider access looks a little bit different right now. Some folks might be a little bit worried that they might injure themselves if not exercising properly. So my advice for that is to start small and work your way up. And also, I'm going to share with you a number of resources to help you to better understand what good technique might look like to help prevent injury. Another one that, we all experience this. How many of us have told us, oh, we're going to go to the gym today, and we didn't? It happens, and sticking to an exercise routine is something that we all face as a challenge. So my recommendations there are to connect with either peers, family, or friends to help hold you accountable. Making a plan and even setting reminders. So for example, setting a reminder on your phone if you know that 2 o'clock in the afternoon is the best time for you to exercise, and setting in a little alarm or a reminder in your phone can be really helpful. And if you don't know what to do for exercise, well, that's what I'm here for. Hopefully to give you a couple of recommendations. And these aren't all just from my brain. I've tried to compile some resources from a number of amazing brains, particularly here within North America. Tired and lack of energy. A little bit of a plug here for SCIBC. Sometimes it can be helpful to commit to a workout where you have others that are also attending, maybe depending on you, or finding activities that you're excited for. I really love to think of physical activity as something to look forward to and not something that you have to do. And likewise, coming back to that planning can be really helpful if you have a set time in mind for when you'll exercise. And if you don't have equipment, I have ideas for that. I'll share that in a moment. And the last thing here is pain. You know, pain's a big one, but hopefully with these wide range of resources, you know, we like to think of, you know, work what works at this time, you know, especially if you don't have access to consult with your healthcare provider about how to deal with that pain. So on the note of equipment, so if you have a body, you have equipment in some way, shape, or form. So free weights are things like dumbbells, and those are, you know, some things that you might find traditionally in the gym. But if you don't have access to that, we can use things like cans. I've been using chickpeas for the past month and a half for part of my strength training equipment. Larger, small bottles that are refillable. So for example, water bottles. Just the other day, I was out in the park and I saw a woman exercising with a very large laundry detergent bottle. So all those things you can fill with more or less water to modify the weight. As I mentioned, your own body weight. So even doing something as simple as lifting yourself in and out of your chair, you're lifting your own body weight if you're able to, but also it helps to decrease risk of pressure sores. Resistance bands are another really handy piece of equipment. You can do just about any exercise with a resistance band. So resistance bands are these elastic bands that provide tension as you pull further away. And these bands, you can find them on Amazon. I've just included an example of where you can find these resistance bands, relatively very inexpensive, you know, $5 or so for a pack. And if you have difficulty with grip, something you can do is you can have someone help you to tie sort of a loop at the ends of each of those bands, or you can wrap around the wrists as ways to supplement the grip. Another one that I really like, if you have none of those things and you don't like to use online shopping, Megan from Ocean Rehab recommends using things like tights or pantyhose, are another way of finding resistance bands. And if you want to lift heavy, thinking of, you know, folks like Daryl who lifts the stack at PARC, you can do things like fill a backpack with books or whatever it is that'll make it heavy, and the backpack helps to keep it all together in one spot. So those would be my recommendations for what you can do at home for strengthening equipment. For aerobic equipment, I'm coming right back to that body. Everything from, you know, a dance party to, you know, aerobics, to kind of where you can follow along with the video. Dance parties with kids, especially I find with kids, love that, are really great ways to just move the body. Other things that you can use, for example, I take my broomstick, or, you know, if you have something fancier like a dowel, you can do things like rowing motions. A tabletop arm bike is nice, obviously not something that's necessarily found in home, but you can find them in the range of anywhere between $50 and upwards. One recommendation I would make is if you are looking for an arm bike, some of the biggest gripes clients will have when they purchase one of these is just to make sure that you've found an arm bike that can be stable on a desktop. So if there's a way to adhere it to the table so it's not shaking around everywhere as you're exercising. And then the second piece there is kind of the bonus, is if you're able to find one that has resistance in both directions. That's kind of an added bonus that you can work different muscle groups. And then likewise, coming back to our resistance bands and free weights, if you have light weights with those and you do high repetitions with minimal rest, you can also turn that into an aerobic workout. Now, there are a ton of resources. I think something that we've learned in this time is there's certainly an infodemic out there. So I want to point your attention to 4 key resources. Kathleen has nicely talked about some of SCI Action Canada's resources. One in particular here I want to mention is the Active Homes resource. So it comes in both PDF form as well as videos, and it gives you examples of what you can do with those resistance exercise bands that I mentioned. From the same lab group as Kathleen mentioned, there are a number of supporting resources for the guidelines as well that you can see. Now, all of these resources that I'm going to mention hereafter, I've sent a link that, or a list of links to Teri and Jocelyn. So I think they're able to share that. So you can just go and click away and don't have to memorize everything I'm saying here today. In addition to SCI Action Canada, NICPAD, or the National Center on Health, Physical Activity and Disability has probably the most comprehensive set of videos on exercising with a spinal cord injury or other disabilities that I've ever come across. So I do really encourage you to check out NICPAD. In addition to that, they also have things like a workout of the day, as well as online personalized coaching. So I do recommend checking out NICPAD. And of course, YouTube. You can find a ton of videos on YouTube, especially helpful for helping you to meet those aerobic exercise recommendations. I've compiled a list of aerobic exercise videos that might be helpful, that some of my upper year students have compiled together in inclusive physical activity. And of course, you know, not because I know who's listening in on this call, but Spinal Cord Injury BC has a number of resources, especially if you're wanting to look and connect with your community. So from there, I'll take it into what our strategies are. So if I was to boil it down to best bang for your buck for your strategies, where if you know what the resources are, you know what you want to do, but it's about keeping that link between what you want to do and actually doing it, I recommend two things here. So one is to make a plan. It's that action plan that we call. And what's really unique about an action plan is it's really specific. So we're going to talk about what do you want to do, where you want to do it, when, how long, and how hard. So you lay out all the specifics of what your goal is on, for example, you can put it into a calendar. It can be really helpful. Second piece here is to keep track of how you're doing to meet that action plan. Now, some folks will use things like a Fitbit or other technology wearables. Something I just want to point out and keep in mind if you're using this device as an individual with spinal cord injury. These weren't necessarily designed to track wheeling, so don't be discouraged if it's not picking up everything that you're doing. My recommendation is if you are using these wearable devices is to look at what you are doing yourself and set that as your benchmark rather than these benchmarks that are set for other populations. So see how you're doing and see if you're improving from week to week if you're using that device. Otherwise, just old school, bring it back to checking it off on a calendar and see how you're doing.
Thank you, Jasmin. I'm going to pass it back over to Kathleen just to talk a little bit about the Get in Action.
Great, thank you, Teri. So Get in Motion. As Jasmin mentioned to you, lots of people have great intentions to be physically active, but we all know the toughest part is really following through with those great intentions. So as a result of COVID-19, my team has rebooted Get in Motion. So Get in Motion is a service by which we provide free telephone-based or video-based physical activity counseling for Canadians living with a disability. This was a program I operated for 8 years previously when I lived back in Ontario. And we shut it down when I moved out to UBC, and it was specifically developed for people with spinal cord injury. But with the COVID pandemic and knowing all the people who use PARC and many of the other programs that myself and my colleagues provide, we wanted to make sure that there were supports in place for people living with spinal cord injury and other disabilities to get ongoing motivational counseling. So the way this program works, it's completely free. And you can see the email at the bottom there or the phone number. So the way the program works is that you can call in or send an email, and all of the people who work on the Get in Motion line are volunteers who are trained in adapted physical activity. Many of them, you might recognize some of the people. They're some of the PARC volunteers are helping volunteering with Get in Motion, but we have volunteers from across Canada, and you can meet as frequently or as infrequently as you'd like with your volunteer. You might have questions about what equipment to use or what exercises to do. A lot of our participants say that they just simply like being able to speak to someone each week who's going to call and ask them, you know, did you do your exercise? Did you do your physical activity? So I'll leave that information as well with Teri and Jocelyn. And please, I encourage you to take advantage of Get in Motion. Back to you, Teri.
Awesome. Thank you, everybody. Okay, we're going to open it up for questions. There were some advanced questions that came in, so I'll maybe start with those. So the first one, and maybe we'll get Shannon and Cynthia to start with this, and Jasmin and Kathleen, if you have, you know, some suggestions as well. But so what can I do to build or improve or maintain good lung respiratory function?
Do you want me to start with that? Okay. I mean, Jasmin and Kathleen, I'm sure can add, but their very useful exercise recommendations are, of course, important. And I think the important thing is when you're exercising to get to a moderate or enough of an intensity of exercise that you are really working your respiratory system. You should be huffing and puffing a bit, short of breath, without feeling like you're going to pass out. And that's that early day thing that both of them spoke about, that you may have to work up to being able to tolerate that intensity for an extended period of time. But one of the things in physio that we recommend a lot with people, especially the higher thoracic and cervical injuries, is to look at using lung volume recruitment as a standard of care to maintain lung and chest mobility. What can happen if you are missing some of the motor supply to your trunk and the muscles that help you with your good vital capacity and good excursion in your trunk. Over time, you can become stiff, you can lose compliance in the lung tissue. And there's a bag, and right now at GF Strong, we give them out. The BC Rehab Foundation gives them out free. And then we would instruct you how to use them, but you basically stack breaths of air into your lungs to increase and stretch the lung tissue to get a good volume of air in, and also stretch the rib cage. And that can be very good as just a standard preventative way of managing your lung. If you get stiff and if you don't have enough air volume in your lungs, it also can affect your voice volume. And so it can be very helpful for all of those things. Then just the standard of care for respiratory is drinking lots of fluid, making sure that you don't, get sputum and a buildup of thick sputum, because that's a site for infection and then possible pneumonia.
Jasmin, Kathleen, anything to add there?
I can add just a little bit there. I think the default certainly would be to listen to Shannon's recommendations, especially from a physiotherapist perspective. I can speak a little bit to the aerobic exercise piece there, and Shannon's absolutely right about that moderate intensity as being the threshold that we want to meet and exceed. And one thing that I find is really helpful for seeing if you've met that threshold is the talk test. So at moderate intensity, you should be able to talk, but not sing a song, because as Shannon mentioned, you're kind of huffing and puffing too much to be able to sing a song. So that can be sort of helpful. And in terms of what you can do for aerobic activity, Jocelyn shared some links that I've shared with her on, for example, there's some rowing videos and some aerobic dance and exercise videos that can be helpful to do at home and meet those aerobic exercise guidelines.
Thank you. All right, Shannon, I think this is for you as well. So for GF Strong specific. So options, so you mentioned that the outpatient program is still somewhat open.
Yep.
So what sort of criteria, I know Cynthia sort of mentioned it, is it only for people with wounds? Who would they be willing to take? And the other question, I think from Linda related to that, is could you come in and still use the bathroom and things like that at GF Strong? And then where can we find mechanical devices such as braces to help us?
Okay. So first off, right now, the criteria they're looking at for us seeing people is if we think there is a safety or a deterioration that would happen within the next 4 weeks. and those are the people that might lead to a hospital admission or injury of some kind. We will see them face to face. Anyone, we've done phone calls with all sorts of people that are active on our list, so we will do phone consults with anyone. It doesn't have to be emergency. So if you're at home and feel there's a question or concern you have, you can contact GF. We've been trying to go through our active list. If you're not on the active list, then you do need to get a referral in. But we're taking referrals and looking at each of the referrals, and if they are a high priority, we will look to see them. If you did come in for an appointment, you certainly and needed to use the washroom, there are a number of private washrooms, and we would have you use a private washroom, not a group washroom.
Do you want to mention about attendance? Like having people like, so sorry, I'll just contribute. Sorry. There's also been the center-wide rule that people who are being seen in person at GF Strong from the community are only supposed to come themselves, not with family or friends. However, if they have a care aide that tends to go places with them to provide assistance, people are allowed to bring one attendant care person with them. And they will also have to abide by all the procedures that are put in place right now at GF Strong. So whether or not that's masking, hand washing, that type of stuff. But you can't have someone drive you and then they also come into to the appointment. Like sometimes we have family members attend. It has to be someone that you require that person's assistance.
Yeah. And then the last question about bracing, GF Strong has changed just recently, and Vancouver Orthotics has taken over the orthotics area downstairs, and they are now providing service. And if we feel someone needs to be seen by them, we can arrange an appointment. And if there is a safety concern with bracing, I mean, that's mostly been lower limb. I know I did do a Zoom consult, the OT and I, with outpatient that was having a very difficult time with one arm. And we recommended, she just went and got the brace that we recommended, and she's trying it. So we're trying to consult with her over the phone for right now. But as it's passed, she is coming in next week to see the physician. So we, if things don't improve, we will move it along. If she's having really transfer and safety concerns with her presentation, so we'll try to get them seen and get things addressed.
Thank you.
Okay, I hope, did I answer all of them? I think I did.
I think so, yeah, sounds good. All right, so this is for everybody, pain management. So if you're seeing a therapist for some pain management, what are some things that you could maybe be doing from home?
Oh, that's a fairly broad question because it really depends on the pain and the type of pain. And so I think if it's really acute pain and there's swelling and acuity, then we really standardly advise rest and ice until it settles down enough to start some active supported but active pain-free movement. And then and it is difficult. Like I've been trying to assess someone over Zoom, and without doing a physical assessment, it's sometimes difficult to know what it is specifically. But if it does appear to be posture related or related to seating, we may try to get them in to get started on that. If it is shoulder problem due to maybe some weakness and seating, we'll try to start addressing. So we'll try to do some specific recommendations, but if it's neuropathic pain, then that's a whole nother concern, and we would address it quite differently. So I think it would have to be a specific one-on-one discussion to really try to address it effectively.
I can add a little bit on a different take to pain management. I think you're always trying to look for the source of the pain, but being a lot of people are at home a lot more right now, which might present an opportunity for some people to explore mindfulness training when it comes to pain management, regardless of what kind of pain it is, whether it's musculoskeletal pain, neuropathic pain. There's a lot of research evidence to support mindfulness as a way of helping dampen down your nervous system's pain response. So the internet has a lot of great resources, and YouTube has a lot of great resources for mindfulness and meditation, specifically for pain management. One local therapist, Neil Pearson, he's a physiotherapist up in the Okanagan. He has spent his career doing a lot of work around mindfulness and pain management. So I don't have the specific website address for his resource website, but I believe his website is called Pain Is Now. I believe his name is Neil Pearson. Anyhow, he is kind of the leader in this area, at least for BC and Canada. So you can always look at his resources. He has some online guided mindfulness training specifically for pain management. So that would be another avenue that you could do if you're at home and have the time and having an issue with pain right now. That would be something that you could look at. And like any type of new skill that you're learning, whether it be exercise or anything else, mindfulness is something that you're not going to do once. It's not like a medication where you take it and it has an immediate effect. It's something that you need to practice and do for several weeks before you might start seeing an effect on your actual ability to dampen down your nervous system in response to pain. So my thought would be my recommendation would be if this is something you want to look at, don't do it once or twice and then give up on it if it's not showing an immediate effect. It's something that should be practiced 10, 20 minutes a day, as often as you can over a period of time. And then after a couple of weeks, hopefully your nervous system should start not being so sensitive to your pain generators.
Yeah, we've been doing a lot of work, a lot of research in our lab recently looking at exercise and neuropathic pain. So if neuropathic pain is an issue, what we see is that I think most people who have neuropathic pain will get a little bit or some relief from exercise. The thing is it might be a bit of trial and error that we see. Some types of exercise might increase the pain, whereas others reduce the pain. I think the key thing is that the exercise probably needs to be of a higher intensity, which meaning that you'll need to huff and puff a bit to get some of the benefits. And that's probably because of the physiological mechanisms that trigger the decrease in neuropathic pain. So my advice would be to first of all, to monitor the neuropathic pain when it's happening and what it's happening in response to, and then to have a go with exercise and monitor the pain sensations from before to after the exercise, so you can gauge what types of exercise, what frequencies and intensities seem to be reducing the pain.
Jasmin?
No, I think they've all covered it beautifully.
Awesome. Just as a little bit of a background, some people are sort of trying to make the choice who may need caregiver support, whether they cut down on that support just to decrease the risk, Are there things that we can be doing at home to sort of increase our independence with our activities of daily living?
I guess I'll take this one on, being the OT on the panel. That's a big question, and very hard to answer, again, without knowing the specific function of the individual and the issues they're having and their environment. If you're wanting to try and reduce the caregiver assistance you're getting, I know it's a challenge for a lot of people, particularly if they have caregivers provided through the public system, and you could be getting different people, you know, several times a week. And so it's a real challenge when you're trying to reduce your contact with people during this time, but still have your needs met. So if you're looking at trying to reduce your caregiver hours, the first thing that I would suggest to you is discuss it with your community care, community case manager. I would be, and I am just talking off the top of my head, I would just be cautious at voluntarily reducing your hours, because when you give something up, it's hard to get it back sometimes. So that would be my one little disclaimer is, I think it's very important for people to try and be mindful of their own personal health right now. But also, if you give something up, you may have a difficult time getting it back, you know, when we get through this. That being said, I think it would be important to prioritize what it is that you need to do. If you want to look at being more independent with your day-to-day activities, is what are the most important activities for you to be doing, and what is it that is most reasonable for you to try and be independent with? Or what is it that maybe the caregiver can assist you from a distance, but less kind of direct care to help you with things? So if, for example, with your dressing in the morning, if you know you have caregiver help, and dressing is difficult for you, so a lot of people will get help with dressing, not because they can't do it, but because if they were to be independent with dressing, it would take them half an hour, versus if they have caregiver assistance, it takes 10 minutes. So that might be an activity that you choose to be more independent with, and take the time to be independent with it, and the caregiver can lay your clothes out, do other things to help around the house while you're spending the time getting dressed, and they're not in really close proximity to you. One thing that I will share with people is we've been advised as therapists, whenever possible, if you have to kind of get closer to someone than 6 feet apart, we wear a mask. So I think it's very reasonable right now for people to be asking their caregivers to wear a mask when they come in the house. Whenever we enter GF Strong, everybody washes their hands. There is a hand sanitizing station as soon as you come in the front door, and we have people now who are monitoring that at the front entrance. So I think it's very reasonable for you to have a hand sanitizing station right by your front door, and you make it very clear to people when they're coming in your home, they sanitize their hands. And then if they're coming close to you within that 6 foot space, they wear a mask. I think that also another trick that you can do or ask people to do is if we're interacting with people, with clients, we have been asked as much as possible to work with them beside us as opposed to directly face to face. So that way any droplets that may come from them or come from us would have less risk of causing infection to the other person. So that might be something you could look at if you are needing more direct interaction with your caregiver. Is there a way you can do it so that they're beside you as opposed to right in front of you? So I don't know if that's given any type of tips to whoever was asking the question. Again, we are providing that type of an issue would be something that the OTs here on our team could help out virtually with you. So we are open for Zoom conferences like this, Zoom appointments like this. So we could take a look at your home environment and talk to you with what exactly your caregivers are doing for you and work with you on strategies to basically make it safer for you to do your daily activities.
So we do have, as part of this, also funding. Part of that money is going to supplies and services, home cleaning services. So if anyone is in need for extra supplies or services of that kind, just please email one of the staff members at Jocelyn. Jocelyn would be ideal. She's taking a list. Joss, you want to type your email address maybe in the chat box there?
You can email me to get on that list, and the priority is for people who have caregivers through non-health authority or agency sources who are required to have their own PPE provided. So if you have a CECL caregiver or you have a like an informal family caregiver that you require, obviously it's really hard to get PPE unless you're going through a health authority. So they're kind of the highest priority there because the access to PPE is so difficult. So my email address is jmaffin, putting it in here, at sci-bc.ca. Send me an email with your contact information and I'll add you to our list.
My doctor agrees that my aneurysm is technically an SCI, presenting as T6 incomplete. She and I agree I need solid exercise suited to my hemiplegia. Is Blessin Gym an option, or what alternatives exist? I think we sort of touched on this. We know that Blessin Gym is not, or PARC is not open. So I guess the alternatives would be
Yeah, absolutely. Just to reiterate on those lists that we talked about, and I think especially now it's so important if you're able to connect with the community. So I really do encourage you to take a look at the SCIBC website. They've got a monthly calendar of all their event listings, and non-biased opinion, I think their programming is exceptional.
And I'll also give another plug for Get in Motion. Give Get in Motion a call and they'll be able to give you some basic information on how to get started with an exercise program at home, and hopefully some tips and tricks that'll carry you through until the gym is open again at PARC.
Awesome. I know Linda had a question about exercise. I don't know, Linda, if you want to unmute yourself, you can ask the question yourself, or if you want me to do it for you, maybe I'll do it for her. So she says that she's been exercising mainly on her stationary bike, 30 minutes to an hour and a half on average every day. She's wondering if that is too much. She also does minimal weight exercises with dumbbells. She does like the bike more because she gets the surge of energy after her workout.
Yeah, I can start with that one, and maybe Shannon or Cynthia want to add to that. I think maybe the consideration here is you might want to consider overuse, where if you keep continuing to do the same motions over a long period of time, it has potential to cause damage, but it also might not. So I think one way to kind of look at that is to monitor how you're doing. So, Kathleen mentioned about monitoring pain before, during, and after, see how you're doing over time. Other ways to think about that is also just to add some variety to what you're doing. So it's fantastic that you found the bike as something that you really enjoy doing, but you can do different things like reverse the direction of the bike, work in things like perhaps doing it for shorter periods of time, but at higher intensity. So looking at interval exercise protocols, working in rest days, perhaps even alternating days where you're doing the bike with days where you focus a little bit more on strength training, perhaps lifting, or lifting weights. So just kind of mix it up and monitor, I would say.
And I would just like to add something from a skin protection point of view. I mean, I think it's incredibly impressive that you're doing that much exercise. If you're on a different surface though, I would just, and I don't know your level of injury or completeness of injury, but we always tell or recommend to people whenever they're sitting on a different surface to be mindful to check their skin after they're done sitting on that surface, because the last thing you'd want to do is over time develop a wound which would then prevent you from being able to do that activity that seems to be really beneficial for you. So, and wounds can often be a little red area until they're a much bigger problem. So I would encourage you after you're done your exercise to, take 2 minutes to do a skin check and make sure there's nothing suspicious that could be developing.
Awesome, thank you. Kirsten has a question.
Hi, can everyone hear me?
Yeah, we can hear you.
Hi guys. I just had carpal tunnel surgery, and I was wondering if, you guys might not know the answer, but if there's a list somewhere of physios that are doing virtual physio. I can't hear you, Shan.
Yeah, here I unmuted. Hi. Yes, I would actually say almost all of the clinics are offering some kind of virtual.
Okay.
And my understanding is this Wednesday, there is going to be some kind of announcement about how they're going to start opening up access. So this week there is going to be some of the slow opening starting, but I haven't heard what that means. But I think if you had a therapist you've gone to in the past, or if you don't know one, well, you can go to BC Physio Association and put in find a physio.
Okay.
And then you can look at an area, you can say hand therapy, and they'll give you a list of, and you can look at where they're located and find someone close to you. That's a good way to start.
Okay.
Or I would also just ask friends or colleagues or people you know if they've ever seen a physio and did they like them. That's often a good way to find someone.
Cool. Thank you.
Yep.
All right, well, it's 10 o'clock. Does anyone have any other questions we could probably take?
Thanks everyone for joining us. That was really helpful. And I think I've had this question more than most others are they open? How do I get access to insert GF service here?
The other thing I would just say, Teri, is you have my email and you're welcome to share that in case anyone still has questions about what GF Strong is offering or how to access services right now. You feel free to give people my email address and I can help them navigate through that if they need.
Fantastic, thank you. Shannon, Cynthia, Kathleen, Jasmin, thank you. Thank you so much. That was really great information, and have a great day and stay safe, everybody.
Yeah, like this.
Bye.
Thanks for having us. Bye.
Bye.
Bye.